There are many causes of pain in your feet. One of the least understood is when the pain occurs on top of your foot. My name is Dr. Andrew Schneider, and I'm a podiatrist in Houston, Texas. We have names for various areas of the foot. Other than dorsal surface, there's none that describes the top of the foot. In today's video, I'll discuss causes of pain on top of your foot. But first, let others know about these videos. Please like, share, and hit the subscribe button. This way you won't miss a new video. There are a number of reasons why you can get pain on the top of your foot. Many people discount when they have this kind of pain, since they just assume that their foot got stepped on and they don't remember it. Let me ask you, do you think you'd forget about being stepped on if you ended up with persistent pain? Me too. One cause of pain on top of the foot is extensor tendinitis. The extensor tendons travel across the front of your ankle and the top of your foot. These are the tendons coming from the muscles that are involved if you have shin splints. The mechanism of these tendons becoming inflamed is essentially the same. In some cases, the pain will be in the front of your legs, sometimes the front of your ankles, and sometimes on the top of your foot. Like treating shin splints, I might consider an oral anti-inflammatory medication. Unlike shin splints, we also can consider a cortisone injection when the inflammation is in your foot or ankle. Extensor tendinitis is usually caused by overuse and instability. The best way to address an unstable base of support is with the use of a custom orthotic. An orthotic will provide stability and efficiency to the feet and ankles. That stability will balance the tendons, making them work less. When the tendons don't work as hard, they don't become inflamed and painful. That's why a custom orthotic is the best long-term treatment to help you prevent tendonitis from continuing to come back. Another cause of pain on the top of the foot is a bone spur. A bone spur can form on the top of the midfoot since it's a high area of pressure. It's particularly common in people with high arch feet, although it can happen to anyone. When a spur forms, you'll notice a bump on the top of your foot. This gets irritated by the top of your shoes. Depending on the shoes you wear, there can be significant pressure on your foot. If you wear shoes that have laces, there is a way to skip the eyelets around the bone spur and keep the pressure off of it. If you wear less forgiving shoes, such as loafers, the pain will likely persist. In cases where you have a bump on top of your foot due to a bone spur, it's commonly treated by removing the bone spur surgically. It's a pretty straightforward procedure and recovery. In most cases, the relief is immediate. When we think of sprains, we often think of a sprained ankle. The foot can be sprained as well. A sprain is a partial or complete tearing of the ligaments that support the foot. I see lots of foot sprains caused by sports like soccer, tennis, and basketball. In all of these sports, you plant your foot and twist. Twist too much, and you can injure your foot. After I take an x-ray in the office to ensure nothing's broken, we address this sprain. A foot sprain can cause swelling, pain, and bruising. I'll recommend that you immobilize your foot for a short time in a surgical shoe or boot. We'll also use ice and anti-inflammatory medication to reduce the inflammation and pain. When you sprain your foot, you'll have to take some time off exercise. In most cases, it's just a couple of weeks, but it may be longer if the injury takes longer to heal. The next cause of pain on top of your foot is a tough one. It's a stress fracture. It's common to have a stress fracture in the metatarsal bones because of the excessive load during activity and exercise. In fact, this is one of the greatest dangers of exercising on a harder surface. A stress fracture is a break in the bone that is not displaced. Sometimes it's referred to as a hairline fracture, but don't let that make you take it any less seriously than any other type of broken bone. A stress fracture needs to be immobilized, and you need to stop activity. Plain and simple. If you continue to run or don't properly treat a stress fracture, then it can become displaced and at best will require a longer recovery. and at worst will require surgery to properly repair the broken bone. You can expect to be immobilized for 6 to 8 weeks with a stress fracture. That's just how long it takes for the bone to heal. Even so, you won't go back to activity and exercise until at least 12 weeks after the injury. I need to know the bone is strong enough to support you when you work out. It doesn't make sense to go back to exercising sooner only to be injured again right away. Thanks for taking the time to watch this video. Please take a moment to like, comment, subscribe, and share on social media to help others find the information they need. If you or a loved one is suffering from pain on top of the foot, don't wait. Come to the office and we'll get on it immediately. The link is in the description. Thanks so much for watching and have a great day.